Hello, my name is Kelly Anderson, and I am a second-year Doctor of Audiology student at the University of North Carolina, Chapel Hill. I would like to thank AAA for the opportunity to present at this conference, and I would like to thank my co-authors for their mentorship on this project. Today, I will be discussing results from an investigation of the long-term speech recognition of adult cochlear implant patients as a function of aged implantation. Cochlear implantation is a safe and effective treatment option for patients with moderate to profound sensorineural hearing loss who experience limited benefit from appropriately fit hearing aids. Patients who use a cochlear implant or CI typically experience significant improvement in speech recognition as compared to their preoperative abilities. A significant growth in speech recognition is observed within the initial months of CI use and eventually plateaus. Some studies report that a plateau in speech recognition performance for adult recipients will occur around 6 months of CI use, while others observed continued improvements over several years of CI use. The time course of acclimatization with the CI, that is, when a patient reaches a plateau in speech recognition growth with the CI, may be influenced by the patient's age and implantation. A significant effect of aged implantation has been observed when comparing speech recognition within the initial months of CI use, with younger adults experiencing better speech recognition than older adults. The primary aim of this study was to assess the influence of age at cochlear implantation and listening experience on the long-term speech recognition of adult CI users while controlling for variables observed to influence early performance, such as duration of severe to profound sensorineural hearing loss and preoperative acoustic hearing. A retrospective review of the UNC adult CI database was conducted and included 387 ears. All participants had a postlingual onset of hearing loss, speech recognition data at least 5 years post-activation, and were fluent English speakers, as the test materials were presented in English. Recipients were implanted with either a Med-L, Cochlear, or Advanced Bionics device. Speech recognition performance was assessed using CNC words in quiet and AZ biosentences in a 10 talker masker at a 10 dB signal to noise ratio, or SNR. The recorded materials were presented at 60 or 70 dB SPL from a sound field speaker, and masking was presented to the contralateral ear when warranted. Figure 1 plots the aided speech recognition over the reviewed intervals, with results for CNC words in quiet in the top graph and for AZ biosentences and noise in the bottom graph. Results are reported in percent correct. The white boxes indicate the results with a hearing aid at the preoperative interval, and the gray boxes indicate the results with the CI at the 1, 5, and 10-year post-activation intervals. Subjects experienced a significant improvement in speech recognition over time with the CI as compared to their preoperative performance. Table 1 lists the variables included in the analysis, which were duration of severe to profound sensorineural hearing loss, preoperative low-frequency pure tone average, a measure of acoustic hearing, the test interval, and age at implantation. Variables with a significant main effect on speech recognition for CNC words in quiet or AZ biosentences and noise are indicated with bold type. For CNC words in quiet, there was a significant main effect of low-frequency pure tone average and age at implantation. Notably, there was a trend toward significance for test interval, reflecting the improvement in performance noted in Figure 1 through the 10-year interval. For AZ biosentences and noise, the only significant main effect was age at implantation. There were non-significant interactions between age and the post-activation test interval for both tests. This indicates that younger adults continue to experience better speech recognition than older adults with long-term CI use. That is, the pattern of acclimatization is not significantly influenced by age at implantation. Specifically, these results suggest that performance in quiet drops by approximately 5% per decade between 18 and 91 years of age, and performance in noise drops by approximately 7% per decade between 18 and 91 years of age. Overall, the present report demonstrates that adult CI recipients experience significant benefit in quiet and noise with the CI as compared to preoperative abilities with appropriately fit amplification. An effective age at implantation is observed in quiet and noise, with younger adult CI recipients demonstrating better speech recognition than older adult CI recipients. The effective age at implantation may persist out to 10 years of CI use. A clinical recommendation is to assess speech recognition over time in quiet and in noise to aid in the decision-making for when to counsel on listening strategies and assistive technologies to maximize CI recipient speech recognition. Thank you for your time. Have a great day.